Assalamu alaikum. Ultrascan Diagnostics here. This is the CBCT of the patient that you had requested. The area of interest is the lower right wisdom tooth and its approximation to the inferior alveolar nerve. On the panoramic view, you can very clearly see that the inferior alveolar nerve is touching the apex of the lower right wisdom tooth. On the transaxial view, which is basically the proximal view, this is the mesial aspect of the 8. As we move towards the distal or the middle, you can see that the inferior alveolar nerve is in very close approximation to the wisdom tooth on the lower right hand quadrant. Here, the highlighted portion is where the inferior alveolar nerve is. You can very clearly see that the inferior alveolar nerve is in contact with the molar. The inferior alveolar nerve is situated right at the apex, and it is going to be slightly challenging having this tooth extracted because there is chances of certain nerve involvement. The tooth is placed on the close to the lingual cortical plate. We've got a thick buccal cortical bone and thick bone around the tooth. No pedial widening can be observed, and at the same time, you can very clearly see that the apex of this wisdom tooth is curved and hooked right next to the inferior alveolar nerve. This is the sagittal view. On the sagittal view, you can also clearly see that the apex of the tooth is invading the inferior alveolar canal right here, and hence the extraction is going to be slightly challenging because of this aspect. Thank you very much.